It typically develops in premature infants and can lead to complete vision loss. Where and how are eye surgeries performed on newborns in Kazakhstan?
I'm deeply grateful to them. I always keep them in my thoughts. I don't always manage to visit, but I never forget.
What part do volunteers play in helping these tiny patients recover?
We simply offer a piece of our warmth, our hearts, and the skills we know best.
And what makes these delicate surgeries possible?
It was a huge emotional strain for me. I went through so much.
It takes 9 full months for a baby's organs and systems to fully form in the womb, but sometimes that time rounds out too soon. Each year, more than 15 million babies are born prematurely around the world. In Kazakhstan alone, that number reaches 22,000.
Наступила наша долгожданная беременность, которую мы ждали 13 лет. Мы ждали двойню.
I was finally pregnant after 13 long years of waiting. We were expecting twins, but the delivery came too early. I had to undergo an emergency C-section. Our daughter was born, and so was our son. But we lost him on the 3rd day. They were just too little. The doctors in an intensive care did everything they could. They gave him the best medications available at the time, but 3 days later, he was gone. You can imagine the fear and agony I felt for my daughter. Honestly, even the word devastating doesn't begin to describe what I went through.
Переживание за дочь. Тогда это вообще, можно сказать, ужас. Даже слово «ужас» не может описать мое на тот момент состояние.
Since 2008, Kazakhstan has required that all newborns weighing over 500 grams receive full medical care, including specialized treatment. Before these live birth criteria were introduced, the country recorded between 30 and 40 infant deaths per 1,000 births. Today, that number has dropped to just 4.
Дочь родилась весом 960 грамм.
My daughter was born weighing just 960 grams. She was tiny, and she was premature. Her condition was critical. She was placed in the intensive care where she had to gain weight and stabilize just to be considered medically stable. About a month later, she was transferred to the neonatal pathology unit. 3 days after that, the doctor told me she needed emergency surgery. She had retinopathy in both eyes. That was the second big shock. I had never heard of it before. I didn't know what it was, how it happened, or what it could lead to.
Какие последствия и так далее.
Retinopathy of prematurity can lead to permanent blindness. The condition primarily affects babies born too early. That's because the retina doesn't fully develop until the 38th to 40th week of pregnancy. In preterm infants, this process is interrupted. Their retinal blood vessels don't have time to form properly. Outside the womb, those vessels begin to grow in a disorganized way. They can rupture, bleed, and even pull on the retina, causing it to detach.
Если раньше мы таких новорожденных отправляли бортом санавиации, отправляли в республиканские центры.
Before we had to send newborns like this to national centers by air ambulance. It was a huge logistical effort, and the transport itself posed serious health risks.
Риски с проблемами со здоровьем с этой транспортировкой. То сейчас, обучив специалиста, получив.
But now, with a trained specialist and cutting-edge equipment for laser correction and diagnostics, we're able to treat retinopathy locally.
Стадии этого заболевания мы осуществляем.
We perform laser procedures and inject targeted medication directly into the eye, preventing the disease from progressing and helping to preserve the child's vision.
Здесь у нас
С Since 2018, we've screened 2,832 premature babies for eye conditions. Out of those, 402 were diagnosed with retinopathy of prematurity. 92 needed surgery, and we sent them to clinics in Astana or Almaty.
Те дети, которые мы отправляли в Астану, в Алмату. Но с 2022 года у нас мы...
But in 2022, we received our own laser equipment, and since then, we've operated on 33 children locally. 9 of them also received intravitreal injections. These injections work incredibly well. In many cases, we don't even need to follow up with laser treatment. They help the retina fully develop within 4 to 8 weeks.
8 недель дать развитие, полное развитие сетчатки.
Kamshat Meshitbayeva began her medical career in the Hromtau district of Aktobe region. She started out as a pediatrician, then spent 7 years as a general practitioner. But everything changed the day she stepped into a neonatal unit and met the tiniest patients. That moment redefined her path. After moving to Aktobe, she retrained as a neonatologist. Then she noticed something crucial missing from the care team, an ophthalmologist. So Kamshat Meshitbayeva opened the books once again and became the specialist her patients needed.
На тот момент первое знакомство мое было вот с этим врачом, с Камшат Булатовной, который именно оперирует в нашем регионе.
That was my first time meeting Dr. Kamshat Bulatxhaza, the surgeon who operates on premature babies in our region. Back then, I thought she was cold, even harsh. I remember asking myself, why am I crying in front of her? She didn't say a single word of comfort, no sympathy, nothing.
Ничего такого нет. Вот строго по делу она мне сказала: все, не подходи, забудь, отпусти.
She just looked at me and said very firmly, don't go in, let it go, don't think about it. I'll tell you when it's time to see your child. That day, I couldn't breathe, I couldn't sleep. When I finally saw my child, it was truly overwhelming. Only a woman who's been through something like this can really understand. But over time, I realized something. Her approach was exactly what we needed. In that word, we were all on edge, crying, panicking, falling apart. If the doctors let their emotions show, if they were soft with us, we'd collapse completely. We needed strength around us. And in time, I understood she was right.
У нас не будет того стержня. Уже спустя какое-то время, конечно, я уже осознавала, что, поняла уже, что все это они делают правильно.
Самая первая операция, конечно, мне помнится, было очень сложно.
I'll never forget my first surgery. It was incredibly difficult. There was no one to guide me, no experienced colleague to turn to. I was completely on my own. The operation took 4 hours. It was one of the most intense, stressful moments of my life. I went through so much.
Doctors are trained to stay calm and focused around their patients, but outside the operating room, they are human too.
Our first surgery took a long time. It was extremely difficult for me, but over time, as they say, practice makes perfect. Little by little, I gained the experience I needed.
At the Aktobe Regional Perinatal Center, no one rests on past success. Pushing forward is part of the culture here. Our future plans include performing surgeries not after birth, but before, while the fetus is still in the womb. 2 centers in Kazakhstan are already running pilot projects in this area. We have submitted a formal request to the Ministry of Health to include our facility in the next phase, as part of the national initiative to develop fetal surgery. This modern center, opened in Aktobe in 2021, is built for continuous progress. Our facility covers 304,000 square meters, all dedicated to serving pregnant women, new mothers and their babies. We have 8 fully equipped delivery rooms, supported by 4 round-the-clock obstetric stations. That gives us a 1:2 ratio of patients to staff. Our delivery rooms are equipped with advanced medical technology, including convertible birthing beds for both routine and emergency care. as well as neonatal resuscitation equipment, including respiratory support systems for newborns and preterm infants. This allows life-saving procedures and stabilization to begin immediately, right in the delivery room. Our center is also supported by an air ambulance service.
На данный момент каждый месяц наша бригада санавиации.
Our medical team handles between 5 to 15 emergency calls each month. And we don't just serve local patients. Women come to us from across Kazakhstan.
Не только жители нашей области, но и из других областей.
Иностранные граждане у нас получают помощь.
We also treat international patients, and that's not uncommon. Women seek our care for both pregnancy complications and routine exams.
Практическими осмотрами.
Был случай у нас, что женщина проездом, она
We once had a case where a woman was traveling by plane, likely from Kyrgyzstan, and during a stopover in Aktobe, she went into labor and gave birth to a premature baby. Both were admitted to our unit. Fortunately, the baby's condition was stable. The only concern was his early birth.
все хорошо, у него тяжесть состояния была.
He was breathing on his own and received a bit of oxygen therapy. The mother stayed with us for about a month, and once the baby's condition stabilized, both were safely discharged.
Находилась у нас около месяца. По стабилизации состояния, по нормализации состояния ребенка, женщина с ребенком выписалась.
И от всех своих коллег соседних стран
Colleagues from neighboring countries have commended our center for its medical capabilities and the level of comfort it provides.
нашего центра, по комфортабельности нашего центра.
They were surprised to learn that such a high-level facility is state-run.
Бежные были удивлены, что такая клиника находится в государственных руках и что беременные
And that pregnant women and newborns receive full medical care here, completely covered by the National Health Insurance Fund.
государство за счет фонда медицинского страхования.
Skilled doctors, dedicated nurses, and cutting-edge equipment, they all play a crucial role in helping premature babies survive and thrive. But these tiny patients have another source of support – volunteers.
У нас есть волонтерская организация 28 петель, которая на благотворительной основе.
We partner with a volunteer group called 28 Loops. For years, they've been knitting custom clothing sets for our newborns using only natural yarn. Each set includes socks, a hat, a vest, and a blanket. But it's not just about keeping the baby warm. These handmade garments actually help stimulate spontaneous breathing in premature infants.
Нужны эти костюмы, нужны они для того, чтобы стимулировать самостоятельное дыхание новорожденного.
Мы отдаем медикам, и дальше на протяжении месяца.
We hand the needed sets over to the medical staff, and over the next month, they pass them on to the babies. Moms use them while they're in the hospital and then take them home as a keepsake. It's something they can hold on to. We don't know these women personally, but through our knitting, through something simple we know how to do, we share a little warmth, a little heart, and in doing that, we give something back to our city, to our country.
Полезны нашему государству.
Есть мамы, мы, которые до сих пор общаемся, детям по 3.
Some moms still keep in touch with me. Their kids are 3 or 4 now. They send me videos all the time. You'd never guess that some of these children were born weighing just 900, even 700 grams. Today they go to preschool, they talk, sing, dance. They're thriving. It makes me incredibly proud. But this is not just my achievement. It's something we made possible together with their mothers.
Это не одна моя работа, это работа совместно с мамой.
Тех врачей, кого я не помню поименно.
To the doctors whose names I don't remember, please don't be offended. Honestly, the anesthesia did leave a few blank spots in my memory. But I do remember Saltanat Said Qaza and Azat Mahsud Ula. He kept encouraging me, Tulesheva, your milk will come. Keep going. Keep trying. And of course, Kamshat Bulat Qaza.
Коде. И Камшат Булатовна. Конечно, я жутко им благодарна. Я всегда их...
I'm forever grateful to them. They'll always have a place in my heart. I don't always get a chance to visit, but we went through so much together, and there's still more ahead. These days, things are stable. We follow the doctor's advice, always.
Стараемся придерживаться всех рекомендаций врачей в любом случае.
Caring for premature infants is a sign of a mature healthcare system. And the ability to perform complex surgeries from the very first days of life shows that the country's medicine has reached a new stage of development.